to bore you guys to death, but hello, my name's Melissa, and I'm just gonna look at your name badge. And can you tell me your name? Okay, and your date of birth?
June 30th.
And how was your night?
It was good.
Okay, awesome. Thank you so much. And why are you here? I heard that it had something to do with you have an infection on your right leg.
Yes.
Is that right?
That is right.
How is your leg feeling?
It's been a little better, but it hurts a little bit.
Okay, and what's your pain on a scale of 0 to 10?
Probably a 5.
Okay, and that's been that way now throughout the entire night, or has it gotten worse in the past hour?
It's gotten a little worse.
Okay, I'll check and see when it's next time for your payments, okay? And can you tell me, I know this is a silly question, but can you tell me where we are?
In the hospital?
Yeah. And do you know what floor you're on?
Second floor.
Okay, that's perfect. And do you know what today's date is by chance?
The 5th.
Okay, and I will change your calendar because to me that helps me if I don't get to leave the hospital. I just always look at that calendar, so that's a good thing to do. Is there anything in particular you want to get done today between the two of us?
No.
Okay.
Not really.
You just want to get better and get out of here with that infection?
Yes.
Okay, and I have a tendency to lead people too much, but I should really ask an open-ended question and zip it. But what I'm trying to do is get at her level of consciousness. I'm trying to get to her level of cognition. Does she understand why she's here and what her goals are, so we judge her and what we're doing. I also noticed that she was alert to person, place, and thing, and I'm very happy with that. As I spoke with her, I could notice that she has a pleasant affect. She smiles. She has excellent hygiene. She looks like she cares about her appearance because it seems to me like she might have a little makeup on. I'm not positive. But for a hospitalized patient, that's pretty impressive. She also has on some jewelry, so to me that's good signs that people care. I'm looking at the symmetry. I'm looking at her underlying pink tones, and all of that is very appropriate. And I came unprepared for clinical. May I borrow anybody's pen light?
Yeah.
Thank you so much. And how about the stethoscope?
Go for it.
Is that good? Okay,
Yep.
thanks so much. All right, I'd just like to look where that oxygen is on your nose. Has that been bothering you at all?
No.
Okay, I'm just going to take a quick peek. Thanks, and now I'm going to look behind your ears. You have gorgeous hair, gorgeous hair. Okay, and I'm going to ask you to look at my nose, and to be able to see better, I would have to put on my glasses, but it's hard for me to see your irises. You've got really, really dark irises. And my nose, not much constriction, not much. But they both reacted to some degree. She has fairly large pupils, and I'd be measuring those in millimeters. They both constricted, reacted to light, and they're round. Would you look at my hands? And I'm just watching her pupils constrict as I bring my hand in. And did you see how her eyes converged? So she accommodated nicely. As I asked her to look behind her ears, she turned her head, so I saw the range of motion of her head. Did you put your chin on your chest? So I don't have to worry about meningeal irritation. She could do that nicely. Okay, would you say ah, please? Okay, and take a deep breath. Okay, and I can't quite see her tonsils, but at this point, without a tongue blade, I'd grade him at a, oh yes, there is 0 out of 4. Her mucous membranes are moist. Her dentition is perfect. Her hygiene is perfect. I don't see any obvious caries or anything that is of concern in her oral cavity. I'm done with my pen light. I'm going to put it back in my pocket. We're just going to go ahead and listen and feel your pulses in your neck. So I'm just going to start on this side. I grade that one. That is a beautiful one. I'm grading it at 2+. And I'm going to grade her left at a 2+. And now I'm just going to go ahead and don my stethoscope. I'm going to pretend that it's in my ears. Would you take a deep breath and hold it, please? I do not hear any bruise. Deep breath and hold it. I do not hear any bruise. So I'm going to bring it down, and I'm going to go ahead and listen to her lungs, starting above her clavicles. A breath in and out through your mouth, please. So I'd go 1, 1, 2, 2. I'm not going to be able to do 3 through the breast tissue or 4. So now I'm going to sneak up without exposing her. And I'm just going to do 5. I'm on her lateral right lung, or should be on her right middle lobe. And now I'm on her lateral left lung, should be her lower left lobe for 5, 5. And now I'm going to move down to get her heart sounds. I'm just going to listen to all of the places on your heart I need to. It's going to take me a minute. You just breathe normally. I'm going to start out with her aortic valve. I'm at her second interspace. And I take a while. Now I'm going to move across the sternum to the pulmonic. And then I'm going to sneak down to the tricuspid. And then I'm going to move up, just sneak up to get the mitral. And then I'm going to note if I heard murmurs anywhere. Well, I've still got my stethoscope on. I'm going to sneak down to this extra large abdomen. And I'm going to listen to this aorta. Now I'm listening to the renal on the right, the renal on the left, the iliac, and now I'm going to listen over the femorals. And in real life, I'm listening against the skin. And I did not hear any brewing. And while I was listening, I heard bowel sounds. But if I didn't, I'd go ahead to the right lower quadrant and listen to her bowel sounds. So I'm actually done with my stethoscope now for the anterior. Now I'd like to tell you a little bit of what I think about her belly. I feel like it's symmetric. I feel it's non-distended. I don't see any scars. I see that she has a piercing that is well healed, and I don't see any redness or any drainage from that area. That's all I want to say about inspection. Now I'm going to palpate. Do you have any tenderness? Does your belly hurt anywhere? Okay. I'm going to start in the right lower quadrant. How deep am I palpating?
1 centimeter.
Okay, thanks. 1 centimeter. And I'm moving around, taking my time, and I'm thinking, do I feel any structures that I shouldn't feel over her suprapubic for her bladder to see if any distension, and then finally up around her umbilicus for any tenderness. So I'm done with, I've inspected, I've listened, and I've palpated. I'm done with her belly. Pulling her hospital gown down. Now, I haven't really looked at her upper extremities much, but I'm going to pretend that these are naked arms. Okay, and I'm comparing symmetry. And I'm looking for edema, and I'm looking for any obvious scars or any tattoos, anything I could use to identify her. And I'm looking at her IV site. I'm going to check the dressing. I'm going to check that insertion site, and I'm looking for edema or redness around that. And then I'm not going to really do anything with strength at this point, but I am going to look at capillary refill. And if her nails were polished, I'd just go to the tip of her finger, and she has instant capillary refill. Otherwise, you can do her nails, and they are instant capillary refill. I notice also they're in perfect shape, and she doesn't have any clubbing of her nails. So I'm done with her upper extremities, except for I need to grab her pulses before I move lower. So brachial, right and left. There's nowhere to hide those brachials, and they're 2+. They're very easy to find. 2+. Okay, and then underneath everything, just right on top of the panning line, whenever you check off, you'll be palpating the femorals. And if I could feel them, I'd say I'd grade them. And then popliteals. Anybody in here been able to feel popliteals?
No.
Okay, no, me neither. But I just kind of flex her little legs a little bit. And I can't feel them, but I'm not going to document. Oh my goodness, I think I actually felt a left popliteal. Yeah, that's the first time I've ever done it. Okay, awesome. And I would have graded it at a 2+. So I'm up here at dorsalis pedis, and they're both 2+. And I'm back here now at posterior tibialis, and they're both 2+. And I would like to talk to you about her skin. It looks symmetric. I see no edema. I don't see any scars. I don't see any varicosities. I don't see any skin breakdown. And whenever I look at her feet, I can see again that her hygiene is very good. And I don't see any calluses on her feet. So now I'm kind of worried that you're going to give me a bad grade, so I'm going to look at my cheat sheet. Okay, so I'm studying my cheat sheet, and I think I'm okay on the front side. So now I want to show you what I know on the back side. I'm going to put your side rail up, and I'm going to make believe I've done that. And would you turn to face me now, please? And so whenever you watched her raise her upper extremities up, just like that, and you watched her flip her little body right over, that told me a lot about her strength. It wasn't against gravity, but I could, or against resistance, but I could tell that she could do that very, very easily. So backside, I've got my stethoscope on, and I'm going to listen to her lung sounds on the backside. And I just think so everybody can see this clearly. I can't see through her jacket as well as your shirt. Or if you don't care, can I borrow your chest roll a minute? I just want to show you auscultation sides posteriorly when your patient is on their side. So remember, you're thinking about the scapula and you want to avoid them. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. Okay? So 9 pair, scrunching up, staying over lung tissue, and avoiding the scapula, kind of staying in close to the spine. Any questions about auscultation on the chest wall? So I'm done with auscultation now. I'm done with my stethoscope, and now I'm going to worry about bony prominences. So where do you think she's going to break down the first if she's been lying supine?
Coccyx.
Coccyx is one place, so sure. I'm going to check her coccyx, checking for any redness would be the first sign. Okay, where else?
Heel.
Okay, checking her heels. No breakdown.
The scapula.
Yeah, actually the scapula will break down and the occiput will break down. So looking at all those places, and again, the very first sign is just redness. And that's all there is on the back side. So once you've done the anterior, it is smooth sailing. I mean, all you do is flip them over, finish up with lungs, look at the skin, and you're good to go. Okay. So are you guys okay with that? Any questions about that before we talk about the write-up?
I have a question
Sure.
on the hearing, the 5.
Okay.
What is that?
Do you mind to cover one of your ears? Okay, I'm going to whisper, and I just need you to tell me what I'm going to say.
I have
And-
terrible hearing.
Okay, well, we're gonna support that hopefully with an exam. So just tell me what I say if you would. Green, ball, purple.
Green, something, and purple.
Okay, so she heard 2 out of 3 whispered at from 5 feet. Would you trade me ears? And I try to stand behind them so they can't see my lips. Okay, ready? Dog, cat, blue.
Dog, cat.
So you think you're hearing